Hey guys, I'm going to put this clip at the beginning of each area of care video, which is going to follow. So if you've already seen this clip, then skip past it. I will put the time marker down below as to when this bit of me talking is over with. So I used RobsReview, robbiewolf.com, link is down below, to study for and pass with flying colors my CPNE, which is part of the Excelsior LPN to RN Bridge program. It's the clinical big bad scary test. And it is big bad and scary. But I made a video of each area of care because that's my study technique. I made the video so that I could press play and practice the area of care while the video was going on beside me on my computer. Now, because you have to purchase RobsReview program, I can't give out any information that is proprietary to him. So there will be times in this video where I will blur something, I might cut something out, and all that's going to be left is the motions that you would do when you're doing the area of care correctly without using his mnemonics. Now, his mnemonics are awesome, so I highly suggest that you go onto his website and you purchase the program. It will be worth it. You do not want to fly to wherever, spend thousands of dollars for the test itself, get your hopes and dreams up, and then fail and have to come back and tell your family that you failed. So it's worth putting a bit of money out there to pass it. So for all of his mnemonics and all of his tips and hints and great teachings, get his program. But what I'm going to be showing you now is how to do each area of care going through the motions. Now, there's a few videos which I made which I won't be able to put up here because I put the mnemonics across the screen for each thing, and so that is proprietary to him, so I will just not be able to show those videos. So if there's a few AOCs that are not posted here on my channel, then that's why. So what I do post up here, I hope that you enjoy it. I hope it's useful to you. And if you're absolutely dying to see an AOC performed that I don't end up posting, then send me a message and let me know. But there are other YouTube videos out there showing how to do different AOCs. So I won't make any promises that I will post any additional videos past the ones that I'm about to post, but if I get enough requests, then I might succumb. So enjoy the video. So we're doing fluid management, enteral tube feeding. Alright, medications. So, check documentation. I'm assigned fluid management that I'm going to get a pitcher and a cup, which may already be in the room. So this is going to be the pitcher and the cup and a nun's hat. So I'm going to wash my hands. Drying off. Hi, I'm Alita Rayner, and I'm an Excelsior College RN nursing student, and this is my clinical examiner. Her name is Laura. And before I do anything, I just need to check your ID if you don't mind. Very good. So I see that you are Susie Q, and your birthday is January 1st of 1970. And how would you like me to call you? Susie? Okay, good. So I'm here today because I'm going to be doing a fluid management area of care with you. these cups that you drink. Try to use this urinal. I see the ID band, and then I'm going to go up. The arm. I don't see any IVs. Alright, and then if you don't mind, can I just pinch your clavicle to check if you are dehydrated? Okay, thank you. Okay, very good. No tenting. So, Susie, can I look in your mouth? Okay, very good. So your mucous membranes are good. I'm gonna keep going. Check the tubing for any kinks, any air. Follow all the tubes back to their source. I'm gonna take my gloves off now. Okay. I'm going to pull out of my pocket my Cardex. So this is my Cardex, and I'm going to double check the rate and the type. Okay, so it's supposed to be going at 20 milliliters per hour, and yes it is, and it's dextrose 5% and dextrose 5%. Okay, very good. And this is a Bermuda device. I'm going to gel up. I'm gonna get gloves on. I'm gonna go down the other leg and see if there's any tubing there. All the way up. And I see that you do not have a catheter. Okay. And then looking at your tummy, I see that you have this peg tube tubing, so I would do the same thing as far as gelling and getting gloves on, and looking at the skin, and then looking at the tubing and making sure it's all intact and secure and no kinks. I'm just going to let you know that because I'm a student, I need to give you your meds one at a time, even if it would be easy enough just to take them all back or for me to crush them all together kind of thing. The requirement for me is that I need to give you everything one at a time and kind of talk to you about each med, okay? Okay. So I just looked at the patient, and the patient's body is good to go. And I have been assigned to do tube feeding for your baby. Since you're a little baby, I'm going to go ahead and burp you. And I am going to give. So then I'm going to go and grab the meds. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Okay, so I'm in the med room. Make sure you don't contaminate the clean area of the medication prep area. Okay, so before I get it, I'm saying Susie Q, Susie Q. That's patient. Lisinopril, lisinopril. That's med. 25 milligrams, 25 milligrams. That is dose. Oral, oral to capsule. That's route. Time. The administration time is 10 o'clock and it's 9:30 now. So time and time, okay? Okay, so now I'm going to get my lisinopril. So I'm going to get it. I'm going to put it in there and label the container with the drug name, strength, and amount. And then I'm going to say, okay, so I have my med now. Susie Q, yep, it's for Susie Q. Medication is lisinopril, lisinopril, 25 milligrams, 25 milligrams. Oral is a capsule, an oral capsule. Time, the administration time is 10 o'clock and it's 9:30, so we're okay. So that's okay. So I'm setting it aside and I'm not turning my back on it. And then I say, Laura, would you mind walking with me with this tray of pills so that I can give it to the patient? And she says, yes, certainly. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. And so then we walk out and we come into the patient's room and I wash my hands. Watching, I say, okay, so I'm not turning my back, so I'm going to be keeping sideways, washing my hands. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. And now I'm not turning my back. I'm gonna get the paper towels. And I see you're still standing there. Not turning my back. Now I have this tray of pills that my examiner is so kindly holding, and I get to give them to you one at a time. So now that I'm here, I'm going to do the 5 rights again, which means I'm just going to check a few things. So first I see your name is Susie Q and Susie Q. 1170 is birthday, 1170 is birthday. And then now that I'm here with you, I'm going to check the meds again. So we have lisinopril 25, lisinopril 25, and it's oral. I do at this time. So we're good with our 5 rights. This is lisinopril and it is for blood pressure. Since you're a little baby, I'm going to go ahead and burp you. Get some, do the alcohol. And get gloves on, and I'm going to check the skin around. It looks good. I'm going to examine the gastric tube and the skin around the tubing. And I'm going to get this syringe. I'm going to aspirate And we got 2 cc's of aspirated content, gastric content. I'm gonna put it back in there. Okay. That's gonna go in the biohazard because it came into contact with bodily fluids. I'm going to take off my gloves. And I'm going to alcohol. Record the amount of formula and the type of formula. So this is going to be 80 cc's of Enfamil. And that is going to be written enteral. It's going to be a bolus, and it's Enfamil. And I'm going to look at the expiration date of the formula and write that down. Very important. Don't forget that. The expiration date. Alright, so how's that feel? Does that feel good? Do you feel nauseated? Do you feel stomach pain? Anything like that? Nope. And if it's a baby, I'm going to say a baby is acting like she's not in pain, is not trying to spit up, does not seem nauseated. Mama says that she's acting normal. Since you're a little baby, I'm going to go ahead and burp you. So, more or less, would you be able to tell me what you just heard? Yep, that's correct. So I'm going to document where the IV sites are, what the running fluid is via IV or tube feeding, and the type and rate, and the education. I'm going to do the last step, which is signing. So I gave that, and I gave that. Okay, I'm just going to check over my notes and make sure I didn't forget anything.